Thank you for watching our presentation about our research at Sentara Martha Jefferson Hospital. My name is Michelle Bushrow, and I'm here with Katie Williamson, and we are two members of a larger research team involved in this project. As the pandemic unfolded, we gathered together as a new research team to conduct research about nurses during the pandemic. Here you see a picture of our hospital located on a hilltop on the outskirts of Charlottesville, Virginia. You can also see the full list of our research team members on the left.
We've all heard many times that 2020 is the International Year of the Nurse and Midwife, and suddenly we've all found ourselves thrust into the frontline global pandemic. We had to make many changes in our daily work, home, and social lives. We've had to deal with rapid and continuous change, sustained uncertainty, fear, and isolation from friends and loved ones. To add to it all, the news has been filled with stories of how nurses across our country have been suffering, become ill, and even lost their lives during the pandemic. We wanted to know what happened to our nurses at Sentara Martha Jefferson Hospital, and we wanted to know what they were experiencing. How are they holding up under the stress, and how are they taking care of themselves? We proposed to study nurse resiliency during the unfolding of the coronavirus pandemic, and we wanted to investigate individual nurse, unit, and institutional strategies that were used to cope with and overcome the adversities presented by the pandemic. We also wanted to learn more about the ways that our nurses sustained their own personal resilience.
In order to conduct this study, nurses were invited to join a newly forming nursing research team. Each member of the team completed city training. The research proposal was submitted to the IRB and initially approved in June 2020, with subsequent study modifications approved in September 2020. We used a secure, highly sensitive data Qualtrics survey platform. All nurses received a unique link to complete the survey. The survey link was sent to all employed RNs, about 510. 36% of the nursing workforce initiated the survey and 25% completed it.
This slide shows some of the characteristics of our sample. The participants were predominantly female, about 97%. Most of the participants bedside staff. Most participants had over 10 years of experience, about 57%.
To really understand pandemic-related stressors, we felt we needed to explore more about the nurses' homes. A large majority of respondents were married, well 11% were single, and 11% were separated, divorced, or widowed. The number of independent adults in the household ranged from 1 to 2, with about 2/3 of households having 2 adults. 15% of households had 1 adult, and 15% had 3 adults. The remaining 5% of households had 4 or more adults living with them.
Our research team also wanted to understand the prevalence of childcare and homeschool needs during the pandemic. On the left graph, 20% of respondents reported having infants or preschool-age children at home, and of those, most, about 96%, reported having 1 to 2 infants or preschool-age children at home, while 1 reported having 6 infant or preschool-age children at home. The graph on the right shows that of the distribution of the number of school-age children of the home. About 57 nurses, or 43% of the respondents, reported having school-age children at home. And from that 57, approximately 45 of them had 1 to 2 school-age children at home. No wonder stress and frustration were such high scores. And of note, 1 nurse had 6 school-age children living at home.
The pandemic also caused a lot of stress regarding the health and safety of older adult family members. While we did not explicitly ask about changes to the number of dependent adult family members in the home, we wanted to collect information about this stressor too. In this sample, 15% reported having dependent adults living in the household. Of those, 80% reported 1 to 2 dependent adults in the home.
To learn more about home life might have changed or impacted nurse stressors, we asked about how things changed at home due to the pandemic. Transitioning to virtual homeschooling during the pandemic was a widespread issue for many families. As we noted in a previous slide, 57 nurses reported having school-age children at home, while 54% did not have to transition to homeschool. Of those that did, 77% had to transition 1 to 2 children to the new format. We also asked about job layoffs, furloughs, and other employment changes, and about 69% did not have to have a layoff or furlough or other job change among their household wage earners. But conversely, a third of respondents reported having a job layoff, furlough, or other employment change. Most common reason provided was job furlough, about 6, and job layoff, about 5. Other reasons included decreased work hours, self-employment, business reduction in work hours, and inability to work due to health reasons and change in remote work.
We are very interested to know how the pandemic affected employment status, such as changes to full or part-time status, as well as changes in a primary work unit. Over 3/4 of the nurses who responded to the survey are employed full-time. In this sample, nearly 10% of RNs had a change in their employment status. The most frequent response provided by nurses who stated they worked decreased hours with use of PAL were about 5. One nurse chose to take 3.5 months of furlough. Another reduced hours in order to be able to homeschool her children, and 2 nurses changed their schedule. One nurse reported an increase in hours. Interestingly, about 40% of the nurses stated their home unit changed during the pandemic.
This survey included a series of Likert-style questions about symptoms of stress. You can see the 4-point Likert scale that we used. The top bar shows the results for the stress symptoms more commonly experienced by the respondents, and the bottom bar shows the symptoms that were less reported in this sample. More commonly, frustration is the highest symptom of stress expressed, with fatigue and anxiety also being higher. Noteworthy feelings were fear and sadness. Less commonly, it was noteworthy that the nurses at Sentara Martha Jefferson Hospital had minimum changes in their use of tobacco, alcohol, and some noticed an increase, but not a large extent. Weight gain and caffeine uses are highest numbers indicating a worsening. It is important to note that we are a tobacco-free institution.
To start to assess the self-care practices, we asked respondents to indicate if they already used a practice prior to the pandemic, as well as if they started a new self-care practice in an attempt to manage pandemic-related stress. These basic questions use a yes/no format.
We asked about the self-care approaches that were most commonly reported in the literature, and you can see on this slide these approaches.
A number of respondents were already engaged in self-care practice. Leisure activities, social engagement with family, friends, and colleagues, and yoga were the most frequent practices. Meditation and sharing gratitudes were the lowest at 17% each. The most frequent new practices that respondents began as a result of the pandemic stress were sharing experiences with and gaining support from trusted colleagues, friends, and family, and engaging in fun and rewarding activities. New practices that were not as popular were yoga at 13%, journaling 10%, and writing daily gratitudes at 6%.
Next, we wanted to know more about how respondents felt about the self-care practices they were using. Did they feel the practice was important? Were they able to engage in a particular self-care practice? Was it helpful or valuable? You can see the specific 1 to 4 point scales that we used for each of these.
This slide represents how respondents felt about the importance of the various self-care activities. You can see that nutrition, sleep, rewarding leisure activities, and sharing experiences with trusted family were the most important during the pandemic. Least important was journaling and writing daily gratitudes. This is interesting because a majority of participants stated that they used these self-care strategies prior to the pandemic, but during the pandemic did not find them helpful. The same is also true for yoga, where 88% of respondents stated they practiced yoga prior to the pandemic.
This slide shows how respondents felt about their ability to engage in various self-care activities. Nutrition, sleep, and opportunities to share experiences with others continue to rate the highest here. And you can see that the ability to engage in fun or rewarding leisure time activities understandably dropped off a bit. Participants expressed a persistent lower ability to journal and write daily gratitudes. Again, these were strong pre-pandemic practices that somewhat ebbed during the pandemic. The same is also understandably true for yoga due to the widespread closure of gyms and yoga studios.
This slide represents how respondents felt about the helpfulness or value of the various self-care activities that we asked about. Again, nutrition, sleep are perceived as highly valuable, as is engaging in fun and rewarding leisure time activities and connecting with trusted family. The practice of yoga, journaling, and writing daily gratitudes are perceived as less helpful, and interestingly, sharing experiences and gaining support from trusted colleagues was also ranked lower.
In a rudimentary summary of the survey results, nutrition, sleep, and connectedness with family members were consistently rated as the most important, accessible, and valuable self-care strategies during the pandemic. Despite pre-pandemic engagement with yoga, journaling, and daily gratitudes, these practices were consistently ranked as less helpful or valuable, along with reduced opportunity to engage in these things.
In an open-ended question about the most significant stressors, respondents expressed a consistent theme of fear of the unknown and anxiety. 32 of 90 comments mentioned this. Job stressors were mentioned 25 times. Stressors included shortages of personal protective equipment, staffing, and changing communications about processes. Childcare, virtual learning for school-age children, and childcare issues were sources for stress of 13 respondents. Political or anger was also noted.
In an open-ended question about barriers to self-care practices, we see various answers, but there is a common theme: time. Work-life balance and new demands are all factors that prevented this group from fulfilling their usual day-to-day routines with these traits. Time was mentioned in 48% of the total responses for this question. However, the word has many contexts in the responses: time for self-care, family care, entertainment, rest, exercise, and others all contribute to the nurse's stress. Self-care time constraints include exercise routines, running gym workouts, yoga courses, and the inability to maintain these routines is needed for personal resiliency. Because of the social restrictions placed on these, it is having an adverse effects on nursing staff.
And another open-ended question about the most helpful self-care strategies. The major themes are noted on this slide here. You can see exercise being or getting outside, family, support, spiritual practice, and time for self-care were all perceived as valuable. And on the right, you see a couple of quotes from our respondents.
We'd like to share and read with you these two quotes from open-ended questions. Our team was really inspired to read these and many similar statements about commitment and dedication of the many nurses at our hospital. I take a lot of pride in what I do, and having been a nurse directly caring for patients with COVID, what I want you to know is that I am not a hero fighting a battle, because I am not a soldier. I didn't sign up for this, and I'm not sacrificing myself. I'm just a person with some knowledge and a skill set who was ready to help. I've certainly thought much more often about my own mortality and made more efforts to stop putting things off and to love and connect with those closest to me with more intention. I hope this does not change as the pandemic ends.
In closing, as we emerge from this pandemic, we recognize that we are not unscathed and that there will be much to do to continue to heal ourselves. We especially embrace the recent Future of Nursing report, in which we move from just telling nurses what to do to be resilient to advocating for meaningful change to improving our systems so that healthcare professions work in a resiliency supporting environment and system. Thank you for attending our presentation, and we're happy to answer any questions over email should you wish to connect with us.